So I think there's sort of two questions about boosters. One is a safety question, and one is a question on efficacy. So I think, and the time scale at which we get that information comes out differently. So early on with the vaccines in children, specifically, there was a concern raised about potential myocarditis, and I think that in general slowed down the authorization of the vaccine in younger age children just because of that worry. We wanted to make sure that we had really studied the vaccines for safety in the younger age range before we started authorizing it to be distributed on a wider scale basis. I think it will hinge on the sense of urgency in the community about how much potential damage there will be from Omicron versus the sort of unknown risk of possible side effects. So I think the regulatory bodies are going to be trying to make a judgment about, wanting to get kids protected if it turns out that Omicron ends up being, much more problematic in the community. They may err on the side of offering boosters sooner. Whereas if we can keep it sort of under control with existing public health measures, there may be that less of a sense of urgency to give kids that extra boost of protection, in which case we may err on the side of more waiting for the studies to come out of safety of the boosters before we authorize it. So I think it certainly will be, I suspect will be coming, that we will have information on booster doses in the younger age range, but I think we need to learn a little bit more about what the natural waning process is in the younger age range. And that may be different from what we see in adults. So we know from some other vaccines, such as the human papillomavirus vaccine, protection after vaccines after fewer number of doses may be possible in the younger age range. And so this is something I think we need to have dedicated study of to look at how long that immune protection lasts. It's really important to talk about the boosters in children. It is also, I think, equally important to remind folks that there's still a lot of children out there who have not even received the first dose. And I think that as much as anything, anything we can do right now, I think the boosters dose is an important question, but I think we can potentially do even more good in schools by getting higher vaccination rates. And we've certainly, seen that with other diseases, that when vaccination rates drop, puts us at risk for seeing outbreaks in schools. And so I think if I were a betting person and wanting to do everything we can to keep our kids safe, I would advocate, at least for the time being, that we also need to take a layered preventative approach where we employ not just vaccines, but also I think having well-fitting face coverings and distancing and sort of cohorting in schools, I think are also really, really prudent right now. It's really time to take sort of an all hands on deck approach and use all of the tools we have at our disposal. And I think applying some of those other methods that work more broadly for preventing infections are also really critical right now.